Kia ora koutou katoa, tēnei te mihi nui kia koutou katoa e mā takitaki mai ana. Nau mai, haere mai ki te manatū hauora. Welcome back once again to the Ministry of Health for today's update. Thank you very much for coming. Today I'm going to just provide an update on the Omicron response as ever, and also our continued use of some of the tools available in the COVID protection framework. I'm then going to hand over to the Ministry's Deputy Director General Māori Health, John Whaanga, who will provide an update on the Māori response component of the Omicron outbreak. First of all, on the latest numbers today, there are 18,423 new community cases of Covid-19, with 913 people in hospital, 28 of whom are in ICU or high dependency unit. That's quite a drop from yesterday, and the vast majority of that drop is in the Auckland region. Quite a big drop in cases there, which fits with the drop in hospitalisations there, which fits with the drop in cases we are seeing there as well. Sadly today we're also reporting an additional 11 COVID-related deaths, and that takes our total number of deaths we have reported to 221, and the 7-day rolling average of COVID deaths is now 10. I do want to pass on my condolences to families, whānau and friends of those who have passed and that we're reporting today. Now, you will have heard the Prime Minister yesterday, of course, update everybody on the changes to the COVID protection framework. The latest analysis we provided, as I outlined on Tuesday, confirms that significant drop in case numbers across Tāmaki Makaurau and in all 3 DHB areas, and that's been accompanied now a few days later, perhaps about a week later, with a drop in hospitalisation numbers. And the drop in the total case numbers across the motu is reflecting that significant drop in Auckland. So in the 7 days to the 20th of March, there were 24 new cases per 1,000 people in the country, compared with 27 per 1,000 the week before. So saying, that pattern varies across the motu. So Tairāwhiti, it is 44 per 1,000, and Hawke's Bay 38 per 1,000. They're the 2 DHBs with the highest rates at the moment. It's also clear that case numbers are on the increase, in particular in the South Island. From an ethnicity perspective, Māori currently have the highest rate at 35 per 1,000, then Pacific, and their rate is 28 per 1,000. The Pacific rate was the highest but has now dropped. And the rates for New Zealand, European and Asian ethnic groups are currently at 21 per 1,000. A little more detail on some of the rates for the Māori population. There has been a decrease in the number of cases amongst Māori reported nationally for that week to the 20th of March. There were just over 27,000 cases, as opposed to around 30,500 cases the week prior. However, despite that drop in case numbers, there's been an increase during that week in the number of Māori who were hospitalised. It was 232 in that week to the 20th of March, compared with 202 the week prior. Again, we always tend to see this lag in hospitalisations behind case numbers. In terms of actual case rates for Māori, they are the highest in Tairāwhiti at around 112 cases per 1,000, and next highest in the Hutt Valley DHB, followed by Hawke's Bay and Bay of Plenty. So saying, also in most other DHBs in the country at the moment, case numbers are showing an increase for Māori, and in particular in DHBs with large rural areas, where we're seeing case numbers out in those rural areas increase, and in particular higher case numbers amongst tamariki and rangatahi. So it's a very good time, because that will represent a lot of work for whānau, for iwi and communities there, and our Māori providers. So I want to say a huge thank you to our Māori and Pacific Health, Māori health and disability providers across the motu. They're working hard. They will also have staff down affected by the disease or by whānau members with the disease. So thank you for that huge work you are putting in. We are going to continue to identify individuals, whānau and population groups who are more vulnerable to severe illness through our community hubs and through primary care and our Māori and Pacific providers, and ensure that, that our resources are focused on assisting them to manage at home or that they get hospital care if required. But at the moment, around 97% of our cases are managing at home without any particular support, either from the healthcare system or from disability support, or indeed from our social development colleagues. So I'm going to now hand over to John Whaanga. Kia ora mai tātou, and over to you, John.
Tēnā koe Ashley, Aotearoa, tēnā koutou katoa. E rere ana nā tai o mihi kia koutou e mātakitaki mai ana i tai wiwi, i tai wāwā, tēnā koutou katoa. Tēnā koutou i rungi o tātou tini aitua, e hinga mai nei, e hinga atura. Ko koe tērā e wira, haere atura, Aotearoa koutou. Koutou katahi anō ka mate i te mate korowhi, kowhiori nei. Haere atu koutou ki te tini ki te mano, mai mai rā, ko koutou kia koutou, ko tātou kia tātou, huri rauna tēnā no tātou katoa. Today I'll be providing an update on the Māori response to COVID, highlighting the work we've been doing across the sector to support whānau Māori and to keep our community safe. Last December we released the Covid-19 Māori Protection Plan to guide the health and disability systems actions throughout the Māori COVID-19 response. The plan focused on two key outcomes which have remained central to our work. Firstly, protecting Māori communities by increasing vaccination coverage. And secondly, building the resilience of Māori health providers and whānau so they're able to respond to the new environment created by COVID-19 and its long tail. Implementation of the plan is well underway, with progress being made in several areas. This includes gaining new insights into vaccine hesitancy, looking at how we can ensure our providers are supported to sustain their work, and supporting the delivery of clear, tailored communications for our whānau. For the Māori vaccination rollout, we continue to work closely with Māori health providers, district health boards and iwi to increase vaccination coverage amongst Māori, especially our tamariki. Our communications and engagement focus covers a range of efforts to promote vaccination. Booster advertising activity continues with the It's Time to Boost Your Whānau Protection campaign. This campaign has now entirely replaced the earlier Big Boost campaign with a more holistic messaging that focuses on the key motivator of protection and the need to ensure all our whānau members are vaccinated. The Karawhiua campaign also continues, and I want to acknowledge Te Puni Kōkiri and Te Hiringa Hauora for continuing to share positive content with whānau Māori in a way that resonates with them and encourages them to make informed decisions about their health and wellbeing. In addition to our booster and paediatric campaigns, Māori health providers have been partnering with DHBs across the motu to implement sprint strategies that support the Māori vaccination rollout. These kaupapa continue to demonstrate the need to take innovative approaches to reach equitable health outcomes. For example, in Te Tairāwhiti, the sprint event titled Super Shot Kids was staged at 3 separate locations, including Mangatu Marae. In the Lakes area, they hosted sprint events at Ōwhata Marae, Waititi Marae, with a further pop-up event at Ōwhata Marae for a second time last weekend, and a drive-through at Whakarewarewa Village Car Park. And in the Bay of Plenty, there have been a range of events that have been held recently across Whakatane, Opotiki and Kawerau. Several clinics were held in rural communities to help reach more remote whānau and increase their vaccination uptake. Testing also remains critical to the Māori COVID response. So to ensure the equitable distribution of rapid antigen tests to whānau Māori, a network of 29 Māori-led providers has been established. And so far, nearly 6 million rats have been delivered to this network, and approximately 1,000 community partners have received their rats, with over 300 plus iwi and Māori organisations also engaged in the portal to provide supplies. I want to mihi to all our kaimahi hauora, Māori health providers and Māori partners across Aotearoa, who have been working tirelessly to ensure our whānau are getting tested and vaccinated. Ka nui te mihi kia koutou katoa. To make sure our providers can continue supporting whānau throughout the Omicron response, Nearly $27 million has been allocated under the recently announced Māori and Pacific Omicron response package. Importantly, a portion of this fund is focused on supporting workforce capacity and wellbeing, which is a significant issue we've heard about from the sector. In the interest of getting funding to relevant providers quickly, a streamlined closed commissioning process is underway, and the Ministry has invited over 140 Māori health and disability providers to apply, and funds will be distributed in April. As mentioned by Dr. Joe Bourne on Tuesday, the COVID Care in the Community framework has been updated and is now available online. Equity remains at the heart of the Care in the Community program, and equity expectations of hubs are laid out in the COVID Care in Community Omicron framework. So far, 54 hubs have been set up, and the majority of these are Māori integrated. Many are also Māori-led. An example of this is Waikato, which is one central hub and 11 Māori-led hubs. All of our hubs across the motu are providing a range of services for whānau, including the delivery of kaipaks, medication, financial support, which is being managed by MSD, alternative accommodation coordination, health services, and manaaki services, where some hubs are supporting whānau to report their RATS results. Nā reira, a lot of work is already currently underway as part of our Māori response to Omicron. Much of this work is being led out by our Māori health providers and iwi partners. So before I hand back to Ashley, I want to thank each one of you. Thank you for your resilience throughout our response. Thank you for your innovation in the way you deliver services to our Māori communities. And thank you for your commitment to the continued protection of Aotearoa. You have been central to our response since the first outbreak, and we wouldn't have been able to achieve these gains we've made so far without your outstanding mahi. As Ashley said, please know the work you do is recognised, valued and crucial. Nā reira, kei a koutou, nā kai hāpai o te hauora Māori, e aku rangatira huri noa tēnā koutou, tēnā rawa atu koutou katoa, me hoki anō ki te kōrero ōnehe, mā tini, mā mano, karapa te whai. Tēnā no tātou katoa, ko hoa atu ki a koe anoa e Ashley.
Kia ora, John. Thank you very much, and I want to acknowledge the leadership you and your team have provided over these last 2 years. It wouldn't be a standout without me giving boosters a plug. So please, if you haven't had your booster, do go and do that today. For those who have had COVID recently, and if you haven't had a booster, we're advising a 3-month gap. However, book your booster for 3 months from today. Now is the time to do that. Book it in and make sure you get it. It is still important to do it and very worthwhile doing. And finally, 2 years ago yesterday, we announced our first cases of community transmission of COVID-19, which triggered our lockdown and started our whole of government response to COVID-19 in earnest. The Ministry of Health's media statement that day said, "We are preparing to move to alert level 4. There is a clear consensus, the sooner we do this, the better. This gives New Zealand our best chance of breaking the chain of community transmission. This will require all our efforts, and I strongly urge all New Zealanders to play their part." Well, 2 years later on, I would like to thank New Zealanders for playing their part over those 2 years through adhering to lockdowns, through staying at home when sick, getting tested when needed, being vaccinated, including getting boosted, scanning with the NZ COVID Tracer app, at least until this Friday, wearing masks, keeping gathering sizes low, and maintaining physical distancing. Many of these actions remain just as important now as they were then as we navigate this next period of the pandemic. If we keep doing the basics well, we will help to protect not only ourselves, but our most vulnerable people, our young children, older people, Māori and Pacific communities, disabled people, pregnant people, and people who are immunocompromised, perhaps because they are having treatment for cancer. We all know and care about someone in these groups, and our actions to date have helped protect these very people. Let's keep caring about them. I do also want to acknowledge the many sacrifices made by New Zealanders who, at different times, have not been able to visit loved ones in hospital, to be with them when they were in their dying moments, or to grieve for them at funerals or tangihanga. It's thanks to all our combined efforts we're in the position we are in today, where despite our high number of cases and high number of people in hospital, we continue to have a low number of people requiring ICU care, a low case fatality rate, and still one of the lowest death rates in the world. Kia kaha, hoi anō, ka nui tēnā, kia ora koutou katoa. We're now open to questions, so I'm going to invite John back up here to join me because I'm anticipating there will be questions for him as well as myself. Kia ora.
John, rawa ki te reo, nā reira me ki te whānau tane ki te aitoa Hawke. Taku tātou tuatahi, why has it taken so long for the MOH to roll out this strategy, knowing full well that iwi and hapu have been wanting this back in 2020?
In fact, the current plan is the third strategy we've had in place. So actually we did have an initial strategy in 2020. We revised that strategy in 2021. And late last year we revised the strategy again for the protection plan. So we've had a plan in place. We mightn't have done as well in advertising it so that people knew it was in place, but it's certainly driven our response to equity and te tiriti. So the current plan is not just a recent creation. It builds on a foundation we developed over the last 2 years.
However, there is still kōrero that a lot of the resources aren't hitting the ground, particularly in those rural areas. So while there has been good engagement with hapu and iwi, there are some pockets of hapori that aren't getting the resources.
I think, well, I'd put it this way. I think there are still pockets of the country where we have to do better to increase access to vaccination services and COVID-related services. But also we've built some strengths and some foundations. If you look at the range of mobilised services we now have in place compared to 2 years ago, not only providing benefits for COVID, but reaching out to those communities, like you said, that have found it difficult in the past to be able to access. So we do recognise there are areas of the country we continue to need to do well, not only in the rural areas, I might add. There are some of our urban areas where we know we still need to work well too. But if you look at the range of different services we've got in place, the range of mobilised services, the different ways we're delivering health services related to COVID, it's a huge improvement on where we were 2 years ago.
Is the Pākehā modelling showing a decline in the rates amongst Māori the same as the modelling that is coming through, say, with Kaupapa Uruta? And when does your modelling show we will see a decline?
I'm not sure what the difference is between, or if there is a difference between those two modelling. Ashley can talk a bit more about the detail of that. But what I would say is we're trying to make sure that we get the best advice from our experts in country, both Māori and otherwise. So we're always up for hearing for advice or further guidance from people, from some of our scientists, from some of our academics, for instance, and how we can improve. So I don't see those things as necessarily working in competition from each other. We draw advice and guidance. We're often challenged too, quite properly, from people to do better. So all of those things add to the mix, I think, and range of advice to make sure that we've got the best program in place.
So when are we going to see a decline?
A decline
in the rates, and the infection rates. So we're currently rating high. When will we see a decline in that?
My understanding from the consolidation of the expert advice we've received is that we will continue to see peaks around the country for the next 2 or 3 weeks. And I think the other big message from our experts is that we will continue to see peaks as we move into winter, for instance, possibly not as severe as what we're currently experiencing, but we will see them coming ahead.
Why is it taking till April to get that targeted Omicron Māori funding? The 27 million, you said it was going to be ready in April?
Yeah, so that's off the back of funding we've been providing out. We've invested over $250 million in the Māori provider network and Māori providers in the last 2 years, the biggest central investment in Māori provider development in the last 25 years. We are building on top of that, but we've also got to make sure we've got a good process there. It's not just a matter of getting funding and putting it out the door. We have to engage with them providers. We have to make sure that we understand what their needs are so that we can provision for that in contracting, and that's not something you do in a 5-minute telephone call.
And yesterday's sort of loosening of restrictions, are you concerned that's going to disproportionately affect Māori as we continue to go outside?
I think off the back of the advice from Sir David Skeggs and the group there, it's very clearly based on science and our ability to continue to protect the country, and the fact that things have changed. As we've seen in the last 2 years, the way COVID's presented itself to us has changed, and in the same consequence we have to change our response. So we have confidence that off the back of that advice, that the settings we're moving to are going to enable us to move to an environment which is a bit different from where we've been in the past, but still have the relevant protective measures in place to protect our people.
You spoke earlier about equitable delivery. The rates back from themselves, Māori have been behind every single rate the entire time since, whether it be vaccination boost or child vaccination, they still are. Do you think it's taken too long to get to a point where equitable delivery is actually happening?
No, because I think equitable delivery is an ongoing challenge. It's not a one-off challenge. It's not just a challenge in relation to COVID. There are a number of health determinant areas where we have significant challenges and inequities for Māori, and we are often starting from a position where the Māori population is not doing as well as other parts of the New Zealand population. But if you look at what we've achieved in, for instance, in the first and second doses for our over 12s, 6 months ago we were worried about whether or not we would be able to get anywhere 90%, and we've done that. And in the same way, we've got to follow through with the same focus and challenge on the boosters and the paediatric vaccines to follow through and deliver on it.
You also spoke before about doing work around vaccine hesitancy around Māori. What is that work showing and telling you?
I think that work is showing us two broad things, if I put it this way. One is that there is comparisons between what is making Māori hesitant to get a vaccine in the general population, and then there are also particular factors for Māori. Some of it is the experience that Māori have currently and have had previously with government and a lack of trust around that. Some of it's around Māori families' experiences with the health system. So there are things in vaccine hesitancy which the Māori population shares in common with others. For instance, parents wanting some assurance that the vaccine's safe for their children. That's a general a concern for both Māori and non-Māori. And then we have particular areas that are a feature of our work with Māori. And as I said, one of those things is the experience of Māori families, both currently and in the past, with government and government services, and how it is we can rebuild trust around that.
As of last month, the amount of money that had gone out through the Ministry of Health, in particular around Māori-led initiatives, was 78 million of 120 million that had been ring-fenced. So you mentioned 27 million going out in April. Is that from that 120 million that's been ring-fenced, or is this a separate?
No, this is separate. This is part of the $140 million package announced by Māori ministers, led by Minister Davis about 2 weeks ago.
Do you know how much of that 120 million that was ring-fenced has actually been spent here? Because last month
This, I can only talk for the health funding component of that, which has been administered. If I think I'm on the same pathway as you're referring to the $120 million announced as part of the Māori COVID Communities Response Fund last year. All I can talk to is the health funding, and my understanding is our health funding has gone out. It's gone out to our providers and our providers who can develop and lead Māori COVID responses.
Can I just ask one last question, not with you, Ashley, on that stuff? Are you comfortable, I guess, at this point with the amount of money that's gone out, the fact that the rates are still behind for Māori, and yes, it's a work in progress. John spoke earlier about, maybe the message didn't get out to Māori earlier on with those first and second streams. Does it sit comfortably with you that the Ministry of Health has delivered well enough for Māori over the last couple of years?
I think John made the point, it's an ongoing effort, and the area of equity, and particularly Māori, non-Māori inequities, has been something I've been interested in for my entire career. And what I would say is that the delivery of vaccination program to adults in this country for all our groups has been higher than I might have, as high as I might have aspired to, but certainly higher than I might have expected. And through that, as John said, we have made a significant investment in Māori provider development that we can now build off. So that's the first comment I would make. And the second is, and John laid this out, this is ongoing work. There's initiatives, and we get reported to us every week, the sprint activities that are underway to try and reach further into these communities, particularly to get our tamariki vaccination rates up. Now, interestingly, in January, 70% of parents, both Māori and non-Māori, said they intended to get their 5 to 11-year-olds vaccinated. And we're still not there with that, and it's much lower for Māori. So Māori parents were more likely to want to wait for a bit before they got them vaccinated. I think they wanted some assurance around safety, further assurance around safety. But it does give us an idea of what's possible, and so therefore we're aspiring to get the rates for children, for all groups, up to that 70%. Questions?
Dr. Bloomfield, can you just admit that the MOU doesn't know how to talk to Māori, and Māori just aren't listening to you?
Well, I think if you're meaning Manatū Hauora, I have a different view. I think we do know how to talk with Māori, and one of the first things I did when I took this role on almost 4 years ago was re-establish our Māori Health Directorate, and I'm very pleased I've had John Whaanga leading that for the last 3.5 years, and that has stood us in good stead through what has been a profoundly challenging couple of years through this pandemic. And one of the things we were absolutely clear about at the start was that we didn't want a repeat of what we had seen 100 years ago when we had the Spanish influenza pandemic, that we wanted to protect our communities, and in particular our Māori communities, who were by far the hardest hit 100 years ago. And that's an ongoing journey, and we don't intend to stop it now.
But even though the statistics say that actually it's not working.
Well, I think it is working. So again, I'll just point to, as John made the point, we've 90% of our Māori 12 and over vaccinated, which is excellent. We're still doing more of that, and we want to get the booster rates up. There's been significant investment in our Māori providers, and those providers have done incredible work to help protect our Māori communities. And just to comment on the rates that I talked about, actually Māori infection rates in this outbreak were slower to start off, so they were lower for the first part of it, and they've just started to increase, and over the last week or two have surpassed the rates of other ethnic groups. So our Pacific rate was the highest, by far the highest first of all, and then that's declining. So we will see those Māori rates come down as the outbreak makes its way through those areas of the motu where there are higher Māori populations.
So to the work being done on vaccine, you might want to speak to this too, but you referenced some of the reasons or the causes for vaccine hesitancy, particularly among Māori. Why is that work being done now when a lot of those reasons are historical and therefore were known back 2 years ago? Why wasn't the work on vaccine hesitancy done then?
Yeah, well, the work has actually been done. So we've been doing monthly, quite big population surveys since the start, actually since before the vaccination program started. So we started that in late 2020 in preparation for the vaccination program, and we've monitored it throughout, and it's been very interesting to see. Of course, if you recall, when we did those first surveys, the proportion of people who intended to get vaccinated was a lot lower than where we've landed. And so it's been interesting, and we've watched the development of people's attitudes towards the vaccine through that period of time. And really, you've seen a lot of the concerns that they held initially have in fact dropped away. I think specifically with the vaccination for children, I think parents and guardians do have specific issues they're wanting to, and around safety, that they're wanting to make sure of, and that in my mind explains some of the slower uptake amongst tamariki, but we're still intent on getting higher rates for that group.
So if you did know and had this data at the start of 2020, how did we still have an inequitable vaccine rollout?
Yeah, so look, I want to make 2 points there. First of all, that information informed the rollout right from the start. And one of the things I want to point to here is, right from the start of the rollout, we made vaccines available to and supported our Māori and Pacific providers to vaccinate through a whānau-based approach. And if you look at the vaccination rates up until about July, the rates for our over 65s were higher for Māori and Pacific than they were for non-Māori, non-Pacific. So actually, that reflected both our knowledge and then the work and the resourcing up of those providers to do that. As the vaccination program progressed and new age groups came on, we saw a slower uptake amongst Māori, and particularly when it got into the younger age groups. And so we kept the research going to inform what were the drivers, what were the barriers and what were the drivers for those younger age groups as we widened it to the wider population. So it was a journey, and we're still on it. And in particular, we're really keen to make sure that we get our booster rates up for younger Māori. At the moment, for 18 to 34-year-old Māori, only about 40% of them are actually eligible for that booster dose, because many of them had their course quite late in the year last year, and around 30% have taken that up. So actually, about 75% of those eligible at the moment in that 18 to 34-year-old age group have done so, which is about the same as the uptake across the population. But we will be continuing to focus on that group to make sure we get their booster rates up too.
Are you concerned that the infection rates is actually higher, given that Māori aren't actually disclosing their positive status, which is why a lot of the health providers are having to do that for them? So is there concern that the rate is actually higher?
Well, if it is likely higher across the population, there's no data we have that suggests that one group or another is less likely to either test and or report their infections. And in fact, the reason we know that rates are highest amongst Māori at the moment is because they are testing and reporting that, and we'll keep encouraging that. And as John outlined, there are a lot of rapid antigen tests right out with our network of providers and iwi and others to make sure that those communities that need them have got them.
Do you think the rate is?
I couldn't say. We just can't really say that. But what we can do is, on the assumption that the proportion of people who are testing and reporting remains pretty constant, then we can monitor that rate over time. We know it's highest at the moment, and we'll be looking for it to come down. That's a question.
On the eventual decision around the shift from red to orange settings, what kind of factors will you be looking at and giving advice on that? And specifically, what impact would removing the indoor gathering limits have on things like case numbers and hospitalisations?
So we've got a range of criteria, and you'll have to forgive me, I'll have to come back to you after this on just what the criteria are, because that assessment is led by our Director of Public Health, Dr. Caroline Macaurau. One of the things we're going to augment that with when they redo it on Tuesday is we've got all our regional hubs around the motu are going to provide input in terms of what they're seeing around care in the community, the proportion of people accessing that, what their needs are, any vulnerable groups who are particularly affected at the moment right around the country, and we'll get inputs from our public health units as well. So we'll look at hospitalisations as well as what's happening in general practice and in the community, and that will inform the advice around that move down to potential move down to orange, or the advice we provide to Cabinet. We're comfortable, given the current high vaccination rate and where we are in the outbreak, that the move to removing limits in indoor settings, remembering with the continued use of masks appropriately, and most importantly, people continuing to stay home if they're unwell, will continue to provide a high level of protection. And of course, very comfortable with the removal of that limit on outdoor gatherings, which we know are low risk.
That now, removing those limits? Or?
Sorry?
You're saying you're comfortable with that now?
We're comfortable that, Friday night there is the change in the limits even under the red setting. So the indoor limit goes from 100 to 200, and the limit on outdoor gatherings is removed. We're also comfortable that when a move to orange is made, that we will be confident that the risk does not increase a lot with the removal of that limit on indoor gatherings, which would accompany.
Presently, there wouldn't be a great risk of increasing case numbers and hospitalisations, you say?
Well, at the moment, we're still in red. And remember, we're watching on a day, from red to orange, but that's not scheduled to happen for another 10 days or so, I think.
If you
and it will be on the basis of our advice.
If you asked today, should the country move to orange, would you advise it?
Not today, no, because we're still clearly in an outbreak. We know that it is waning quite quickly in Auckland, but it is still quite active in the rest of the country, and we look across the country.
Because it sounds like you're confident that shift could be made today.
No, I'm not confident, but I'm confident that when it is made, and the decision will be based on what's happening with the outbreak, and the question was around that the removal of indoor limits, indoor gathering size limits, that won't create a big jump in increase in the risk.
Will the changes that the government announced yesterday and are due to occur on Friday, will they increase the rate of spread?
No, we don't think they will make a marked difference. And remembering that we're still in red settings, so and for the time being, COVID vaccination certificates, kits are still required, masking is still required. There are rules around distancing and what one can do in indoor hospitality venues. So those remain part of that overall package of protective measures.
On
Just one.
AstraZeneca, it seems like most of I think all of the doses are expiring next month, possibly?
Yes.
Not when you've been used. Does that bother you that we haven't been able to make use of that?
It doesn't bother me in the sense that we have made it available for people who wanted it, who either couldn't have the Pfizer vaccine or who preferred a different one. From memory, around 3,200 people have taken up that opportunity. It's the last 2 days there haven't been any doses administered, so when it expires we'll be providing advice, but our view is we have provided that opportunity and we don't know if that we need to continue to provide AstraZeneca. In terms of Novavax, which has more recently become available, we've just passed around 1,000 first doses of that administered. Again, not huge demand. All these help contribute to our protection across the population, but we've been really clear. The Pfizer vaccine is the mainstay of our program, and that's the one we continue to base it on.
Just on boosters, you said a while ago now that you're looking at preparing advice around the 12 plus.
Yes.
What does that work?
It's very close to being completed. We're just finishing off some work around implementation of that, of the decision when it's finalised by ministers.
So how quickly could that be a go?
Within the next couple of weeks.
And just on, I think you made a change a couple of weeks ago around 17-year-olds. Is that a definite thing now? 17-year-olds can get the booster. Has that message gone out?
Yes, and it wasn't a change. All I did was clarify that with the vaccine, as with any medication, they can be prescribed off-label. I think I said it was under Section 29. It's actually under Section 25 of the Medicines Act. Any prescriber can prescribe a medication off-label, and it would be off-label because it's not been approved in under 18s as a booster. This is the Pfizer vaccine in New Zealand. But any prescribing practitioner can, after a conversation about the risks and benefits, prescribe and or administer a medication to someone off-label, and that would apply to the vaccine. Actually, for anyone under age 18, but in particular there was interest for 17-year-olds who might be going to university and at higher risk of going into a hostel.
So you're comfortable that the people who are administering do know that any 17-year-old or 16-year-old, for that matter, is fine to get it?
Yes, and in fact we sent a communication out to our primary care sector just clarifying that that they could on a case-by-case basis do this. It's on prescription.
What other advice that you've been looking into? You said you were looking into a fourth dose of the vaccine. Where are we at on that?
Yes, and I said on Tuesday I was expecting advice this week. In fact, the advice I received on Tuesday afternoon was that the technical advisory group would like another week to consider it. And the main reason here is that the evidence is quite scanty here. It's emergent, and we'll really be just looking and seeing what other countries are doing. So saying I'm approaching this from the point of view that is there a good reason not to offer a fourth dose if there's evidence of waning immunity, and there is some evidence for that, not to offer a fourth dose to our most vulnerable population groups, particularly older people, and you see a number of jurisdictions are already doing that.
Just for a colleague from the South Island, are you concerned about the surge of COVID cases in the South Island?
Well, I'm concerned about people with COVID anywhere. It's not unexpected, and one of the interesting things, if you look at Christchurch Hospital, I think they've got just about, today it's 53 people in hospital, whereas if you look at the Auckland hospitals, yesterday at least, two of them were up over 200. So far their hospitalisation rate hasn't gone up quite so much. And I think in part that's because they're keeping people out of hospital, for example, older people in aged residential care. And the DHB's got about 30 to 40 of their staff supporting aged residential care every shift because they've got staff off. So I think they're doing some great work right across the system to support people to stay well at home or indeed to be looked after in aged residential care.
You're not concerned about that peak hitting those hospitals hard, given Canterbury does have over 500 staff off work at the moment?
Oh yes, it is a concern, and that's exactly the picture that we saw in Auckland and we're seeing in other places as well. But they, like all our DHBs, have planned for this and have got contingency plans in place.
Is it warranted then, lifting the restrictions yesterday, given the rest of the country is not lifted?
So the restrictions haven't yet been lifted. We're still in red. The only thing that changes is from Friday those gathering limits increase up to 200 indoors and no gathering limit outdoors.
So is that right?
I'm comfortable with it. We looked at this hard and gave our advice.
Just on the shift, the possible shift to orange, is there any argument to delay that shift to allow for more time for people to get boosted, for children to get vaccinated, and to target those groups that haven't had enough opportunity yet?
Well, we've had our booster program going since December, so there has been a huge effort, and we're up around 74% of eligible people have been boosted, and we continue to do that, and our childhood vaccinations keep increasing. Let's see what the risk assessment shows next week, please.
RNZ are saying strengthen the mask exemption scheme, will get rid of masks required in retail spaces. Would that ever be a safe option, do you think, getting rid of masks and such?
So two things here. We've been working with Retail New Zealand and also some of the major supermarkets and our disabled community on the issue of mask exemptions. There's been a pretty clear and constant call for masks to be a requirement, a legal requirement in retail and particular supermarket settings. We haven't ever had that. However, what I would say is it's really clear that masks are a really important part of our ongoing protection, not just of ourselves but of each other. Yes, our vulnerable people can wear a mask, that provides them some protection, but one of the most protective things any of us can do is wear a mask to help protect others and ourselves. So we will keep, and masks remain a strong feature of the CPF, including in the adjusted orange settings. So we will keep supporting and pushing the use of masks and providing them out through our providers so communities can access them.
Is the mask exemption scheme fit for purpose, though?
That's
part of the issue.
Yeah, that has been.
Everyone's just claiming that they've got.
Yeah, that is part of the issue, and we've been looking at this for a month or so and put some options up to ministers about how that could be strengthened, trying to balance up the different experience and expectations of retailers on one hand and also our disabled people on the other hand, and trying to get the right balance there.
And sorry, just Tairāwhiti, is there anything targeted going that way, given that it had the 44 per 1,000 cases and also highest Māori case rate?
So that just happens to be the DHB at the moment. It's got the highest rates and of course has also had some deluges in the last couple of days. But look, they've got at the moment a low number of people in hospital, which is good, and they had done their planning and they have got all their plans in place with that added challenge at the moment from the weather. Sorry, down the back there was a question.
We've got sort of had a few of the deaths in recent weeks have been people in their 20s and 30s.
Mm-hmm.
Can you give more insight into this and the circumstances?
Look, I don't want to and won't comment on individual deaths out of respect, and also just I don't think it's appropriate. But what I would say is we know that, and we saw a tragic case in Australia just reported this week of a previously well 2-year-old who died with COVID. So no one is effectively immune from getting really unwell and potentially dying from COVID. However, we also know that the people who are more likely to are those who are more vulnerable, and they're older people, but also younger people who might have pre-existing conditions or be just living in circumstances, poor housing circumstances or so on. And so it behoves all of us to do what we can to protect everybody.
Well, you have also said that there was a slow rise in infection rates amongst Māori. They were slower to rise. Then was there a missed opportunity there to head that off at the pass before it escalated?
Well, I think that the measures in place were designed to protect everybody, including quite strict requirements under the CPF, and it may well be that the reason that it was slower to take off in Māori was because those measures were working. But we have seen with all our ethnic groups, there has been that increase in cases at some point in time, and then they will decline again. It's just happened at different times in different groups.
Was there an opportunity missed to head that off to Māori?
Well, I think the opportunity was taken for everybody, which was to have in place our COVID protection frame, which was designed to protect everybody, but in particular our vulnerable groups, Māori, Pacifica, disabled people and older people. And that has almost certainly helped us a lot. And again, our hospitalisation numbers are quite high, but our case fatality rate and our total number of deaths remains low, and we plan to keep it that way.
Just on the COVID deaths, able to say any more about, I guess, where they are occurring, and these people who have been very sick and in hospital, or is it people in home care, or are we seeing them in rest homes? And also, have you got more information about people with COVID as opposed to as a result of COVID?
So you'll see from the age breakdown, and we put that in each day in our media release, what the ages were of the people who have died and the gender. And most of the deaths are in people in older age groups, 60s, 70s, 80s, 90s even. And this is very typical with what we see with influenza each year as well, influenza-related deaths. Some of these people are dying and being looked after in aged residential care, some at home and some in hospital. And some of those in hospital will have been in intensive care and had quite a lot of input, but then subsequently died. The issue around, sorry, your second part of your question, which might be the last question. I've told there's one more question, but we'll take one more after this.
With COVID,
Oh, yes. Yeah, again, we are now publishing that where we know on our website. Each day we're updating that as we get more information, the breakdown of people who've definitely died from COVID, those for whom it was incidental, and the biggest group actually still is the ones for whom it's under investigation, because it can take some time, sometimes because of a coroner's process or for the death certification to be completed. Was there two more questions?
Back on the vaccine hesitancy stuff, given the mistrust of the system, and we know all of that historic stuff that has gone on with Māori, vaccine hesitancy wasn't sort of a new thing, that was always going to be something that would exist. Do you kind of look back on that period now, the beginning period, and feel like there was always going to be a vaccine there for misinformation, disinformation to reach those communities, because there was always going to be a period where Māori were less willing to come forward in the vaccination rollout?
Well, the misinformation and disinformation was there already. And our job was to ensure we had really good information out there for people and really good communication campaigns. And, I think on the, if you just look at in the round, I think we've been incredibly successful with our program here across the population group. We've got rates that are amongst the highest around the globe, even though we had to overcome and work through with whānau, with communities, that misinformation, disinformation, and some very sophisticated efforts by those who were anti-vaccination to try and stop people getting vaccinated. So actually, I think what we've turned around was what might have been vaccine hesitancy into a very high level of vaccine acceptance. And I think we plan to springboard off that to get our rates of childhood vaccination up again where they need to be, and also to support our MMR catch-up campaign, which you'll hear more about, and our influenza vaccination campaign this year. So we've learnt a lot, and again, I think, given what we were facing, I think the levels of vaccine acceptance we have achieved are remarkable. Down the back.
From a health perspective, Dr. Bloomfield, what would an endemic look like in New Zealand when it comes to COVID, and when will we know when we're there?
It's a big question. If you don't mind, maybe we could do some work on that and cover that at one of the stand-ups next week. What I would say is that, just make two comments. We are not in an endemic situation yet. There is still a global pandemic. WHO Expert Advisory Group meets, I understand, again on the 11th of April, and will reconsider this question. But there's nothing to suggest globally that we are anywhere near the end of this pandemic. So we're not in an endemic situation. And even if we were, it's quite clear that endemic COVID is a different prospect from endemic flu. So we need to maintain all the actions we've got in place at the moment, even as we navigate, as I said, this next period of the pandemic. Thanks very much for coming up, and thank you, John, for your contribution today too. Kia ora.